Hello everyone! The first equine stereotypic behavior that we will be learning about this week is cribbing. Cribbing is one of the most common equine stereotypic behaviors, and it is also one of the easiest to identify. Cribbing occurs when a horse places its front incisors on a hard, flat surface, arches its neck, and pulls backwards in order to make a characteristic grunting sound. It is also known as crib biting or whinge sucking. People originally thought that when a horse cribbed, it swallowed air into the stomach, but research has shown that very little air is actually swallowed. So the term wind sucking is very misleading. The cause of cribbing is unknown, but veterinarians and researchers have several hypotheses as to why it occurs. The first is boredom. So, in this hypothesis, a horse would develop cribbing as a form of entertainment. The second hypothesis is that cribbing is caused by anxiety, specifically social anxiety. Since horses are herd animals, they often want to be together, and because of this, a horse may develop cribbing as a result of being confined in a stall by themselves. The third hypothesis is that cribbing is a learned behavior that they may learn from their mothers when they are foals, or that they may learn from another horse in the barn. The final hypothesis is that cribbing is a coping mechanism for things that make them uncomfortable, such as pain. In the case of gastric ulceration, which can be very painful for the horse, it is thought that cribbing is used to increase saliva production, which raises the pH in the stomach and makes a less acidic environment for ulcers to form. Colic also has many health implications. The first is hypertrophy of the ventral neck muscles. This means that the underside of the neck becomes enlarged, and it makes the horse's neck look U-shaped or inverted. And this is a highly undesirable trait, especially for horses, and it is one of the reasons why people try to prevent their horses from cribbing. It also makes it very difficult for a horse to maintain weight, and in severe cases, the horse that is cribbing may look like the horse on the right. Cribbing can also cause unusual wear of the front incisors, which may impair feeding ability. So in the two pictures on the bottom of the screen, the horse on the left has a very wavy front incisors, and in more severe cases, this is what could lead to difficulty eating. But the horse on the right is likely a non-cribber who has very straight, evenly worn teeth. Another health implication of cribbing is that it is a symptom of underlying issues. So if your horse starts cribbing, you should be thinking about what might be causing it, or what might be causing them pain that they need to cope with. So some of the things that go along with this are colic and gastric ulceration. Often colic is associated with cribbing. Many people think that cribbing causes colic, but there are many new hypotheses that the two symptoms, cribbing and colic, are related to another issue, but they're considered to correlate with one another because those are the two things that we as horse owners are able to see. There are many management practices that can be used to reduce cribbing. The first, and probably the most utilized management practice, is the use of cribbing collars or cribbing straps. A cribbing strap is a leather strap that is fitted around a horse's neck near the chin. The strap creates pressure, making it uncomfortable for the horse to crib. There are many different kinds of cribbing straps, one of which can be seen in the lower left-hand corner of the slide. All of these options are fairly effective in reducing cribbing. Another way to reduce cribbing is to introduce the horse to companion animals. Introduction of companion animals can decrease social anxiety and reduce cribbing. Another way to reduce cribbing is to increase turnout frequency. Increasing turnout frequency gets the horse out of the stall and into an environment that can explore. This may decrease the amount of boredom that the horse experiences and reduce cribbing. Additionally, horses that are pastured with other animals may experience less social anxiety and therefore reduce the amount that those horses crib. Finally, another management practice that may be used to reduce cribbing is to apply noxious agents to cribbing surfaces. Noxious agents such as Cribox can be painted onto cribbing surfaces using a paintbrush. These agents often have an unpleasant smell and unpleasant taste, which discourages the horse from cribbing. There are also many treatment options to help reduce cribbing. Electric shock therapy and acupuncture can both reduce pain that a horse may be trying to cope with and therefore reduce the amount that they crib. Another way to treat cribbing is through pharmacological treatment, which is medicinally treating cribbing using drugs like naloxone. And this is an attempt to reduce cribbing by acting on chemical receptors in the brain. Another way to treat cribbing is through buccotomy, which is an oral surgery that makes it so that a horse is physically unable to crib. However, many veterinarians dislike doing this surgery and even try to steer away from it because it is very susceptible to complications, and generally speaking, it's cosmetically unfavorable. So if you're trying to curb your show horse's cribbing, this is probably not the best way to do it. Another way to help your horse stop cribbing is through laser-assisted modified force cell surgery, which is another type of oral surgery. However, this one uses a laser to complete the surgery, which makes it a little bit more accurate and a little less invasive. It's less susceptible to complications and it has a better cosmetic outcome, but generally speaking, it's not recommended and it's not done that often. Another more recent way to treat cribbing is through cribbing rings. This is a process in which Seymour pig rings, which are used to help pigs stop rooting, are inserted by a veterinarian into the interdental space between the teeth. The rings stay in place for about 2 weeks, and they work by placing pressure on the gums when a horse cribs. And like the cribbing collar, the rings make it uncomfortable for the horse to crib, so they are less likely to do it. And although they look a little funky, they don't interfere with the horse's ability to eat or drink. So I hope you guys learned a lot about cribbing. Below this video, I have a few more links to help you learn more about the behavior and what it looks like. And I have another video about a cribbing collar that might help you guys to learn a little bit more about how management practices work.